Hi everyone, my name is Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grade 5 to 0. Grade 5 is the ability to hold against maximal resistance. Grade 4 is the ability to hold against moderate resistance. Grade 3 is the ability to hold against no resistance, just gravity. Grade 2 is just partial movement of the limb. And grade 1 is when there's just a trace in muscle contraction. And finally, grade 0 is where there is no trace, there is no activity in muscle contraction. Today, we're going to be performing MMT for shoulder flexion. Alright? Now, the primary mover for shoulder flexion is the anterior deltoid. The starting position of the patient is in a short sitting position, as you can see here. And the starting position of the therapist or the examiner is slightly to the side of the area that will be tested and slightly back. Okay? The instruction that you're going to give the patient is raise the arm about 90 degrees or about the same level as the shoulder, palm facing down, pronated. The stabilizing hand will be placed by the shoulder, on the shoulder by the acromion area, by the level of the acromion, and the testing hand is going to be placed distal arm, or just above the elbow. The instruction that you're going to give the patient is resist me, don't let me push you down. Resist me, don't let me push you down, don't let me push you down, don't let me push you down. And there you have it. That will be a grade 5 against maximal resistance. Alright, so all positions, all the grades rather, for MMT for the shoulder, for shoulder flexion, can be done in a short sitting position. However, when grading for a 2 to 0, if for whatever reason the patient is unable to perform the MMT in a short sitting position, you can always put them in sideline. Line aside for me, please. So the sideline position is in a gravity minimized position. So you want to put the limb in a gravity minimized position to see what the muscle is capable of doing. So as I said from before, if the person is in short sitting, they can perform just partial range. For grade 2 is a partial range. But in a gravity minimized position, you want to be able to perform, they should be able to perform the full range with some support. So I will cradle the arm, as is seen here. So you cradle the arm and give them the instruction to go ahead and move the shoulder forward, move the arm forward. So this is shoulder flexion. And they're able to perform it full range. So all you're doing is cradling the arm, you're giving it some support, and you're able to perform it shoulder flexion. So this is grade 2, shoulder flexion. And remember, grade 2 can also be performed in a short sitting position, but in that position, it's just partial range. Okay? In sideline, which is the alternative, you're performing full range with support. Alright? It's a gravity minimized position. For grade 1 to 0, all you're feeling and palpating for is just a flicker. So grade 1 is just contraction. You're giving them the instruction, try and move the arm forward. And all you're feeling and palpating for is just contraction, just a flicker in the muscle. And of course, a grade 0 is when there is no activity in the muscle belly that you're palpating. This is MMT for shoulder flexion.